Now, it's not often we say there's good news when it comes to coronavirus, but today there is. The first antiviral pill for Covid-19 that can be taken at home has been approved for use in the UK.
The tablet will be given twice a day to vulnerable patients recently diagnosed with the disease, but there's still cause for concern because the overall rates of Covid-19 in England are higher than they've ever been.
This is according to the REACT-1 study that's been collecting data since May 2020. It suggests the increase is being driven by infection in young people aged between 5 and 17.
To tell us what all this means is Jamie Jenkins, the former head of health analysis and labour market analysis at the Office for National Statistics. Is this news something that we should be worried about, Jamie?
Yeah, it's probably worth just kind of explaining these different data sources first, because you get different numbers depending on which ones you're looking at. If you actually look at the government's dashboard, and those are the figures that are published and come out about 4 o'clock each day, we have been seeing cases come down over the last week or so. And what the difference between that and the study today is that the government dashboard is basically people who come forward for these PCR or take lateral flow tests, and then all the information's uploaded and goes into the government system. And then we get that. And what we've seen over the last week or so with that information is cases have been coming down, but in part it's a bit of a half-term effect gone on here in that there's been less testing among children over the half-term period. Now, what the REACT study does, which is the numbers you've just been quoting here today, this just basically selects people at random through the population. So one of the issues you have, obviously, with the government figures published each day, they're only people who come forward, and some people may have COVID who don't present any symptoms. So this random selection of people across the country is done, and then they can estimate the percentage of the population with it. Now, we are seeing this big rise, and I think the study itself is talking about school children being a big factor in all of that. You know, it's no surprise they've been a big vector of the transmission over the last kind of 18 months, school children. And the main difference now, though, compared to, say, this time last year, we've obviously got significant antibodies within the population just from the vaccine rollout. Got the news about this new drug today. Compared to this time last year, I wouldn't say it's as alarming as 12 months ago.
Some would say that actually infection rates are not a really good measure. I mean, you would never measure or test the population for how many people have got a cold or a winter flu. It's deaths and hospitalisations that are the real issue of concern. Tell us what's happening there.
Yeah, so I think one of the things that if we did have a flu vaccine over the last 30 years and we were just tracking flu infections, we would have been probably locking down most of the country most winters. So I think you're probably right there with regard to infections. The important thing is that because of the significant antibodies in the population through just the vaccine rollout, and we know that people who've previously had the infection, that offers a good protection as well, that we are seeing fewer people. So the number of people in hospital at the moment is around a quarter of what we saw at the peak of the winter. And the increases, if you compare, say, this time last year and now, the increases in the number of people going into hospital isn't as fast either. So that's an important thing. Now, one of the issues the NHS does have this year is there are far more patients in hospital for non-COVID because of all the backlog of things trying to catch up from last year. So I think that's the added pressure that you've got. Deaths are considerably lower, about 80 to 90% lower when you compare the number of cases and number of infections there to the number of deaths compared to this time last year. And that in part is to do with the fact that we're seeing fewer cases among older people because most of the cases are driven by the younger people. The big concern is obviously younger people catch it, they pass it on to their parents, who then may pass it on to their grandparents. That's the big concern when you get these spread among younger people.
Jamie Jenkins, thanks for that. Jamie Jenkins there, formerly head of health analysis at the Office for National Statistics.